So some of the key issues that we chose to focus on are the restricted ability to work related to mental illness, criminalization of drug addiction, and the lack of resources for emotional and mental needs related to poverty. According to the Center for Disease Control and Prevention, West Virginia had the highest per capita death rate related to drugs in the United States in 2015 at 41.5 deaths per 100,000 people. In addition to this, not every county in the state has access to psychiatric and psychological facilities. According to Kaiser Health News, there's a woman in West Virginia named Tanya Nelson who suffers from bipolar disorder as well as anxiety and depression, and she has to travel all the way to Wyoming County to reach the facilities that she has to have to survive. And because she can't drive due to her mental disorder, she has to take a bus that has frequent stops. So just going for one day of treatment takes her entire day up, which impacts her ability to work and impacts her ability to live her life in a normal day-to-day fashion. So that's just another facet and another way that mental illness intersects with poverty.
Poverty and mental illness are definitely correlated. There are overwhelming disparities in equality efforts and opportunities for those with mental illnesses just trying to succeed in society.
I do believe that poverty and mental illness are intertwined because oftentimes people with handicaps are discriminated against in employment and they struggle to find good paying jobs.
I do believe that poverty and mental illness are affected. It's been scientifically proven, mostly because people in poverty endure more stress than any other population in society because they're worried about meeting their basic needs. And without having access to mental health care, they don't have a way in which to address these issues.
I've seen it a lot throughout the school system, throughout just different elementary schoolers that I work with. They have just suffered with motivation, with dedication, and just staying truly motivated and driven in what they want to do and what they want to be when they grow up and stuff like that. And it's really hard if nobody is able to provide them with the resources they need to or help them really, because they're little kids and it's really just not as, like, they're just being kids. It doesn't really matter if they're not as dedicated at the moment, but it's really hard to see young students stay driven and stay motivated when nobody's encouraging them through words of encouragement or through actions or anything like that, just kind of leaving them to fend for themselves. It's really disheartening sometimes to see that through the school systems, especially the elementary schools.
I think there's definitely a connection between mental health and accessing or navigating institutions such as the welfare system. These individuals are trying to access resources such as food stamps, public housing, additional assistance, and their mental health illnesses may make them appear to be a threat or incapable of taking care of themselves or their children, so they might be denied these assistances that they need in order to progress.
Just by providing support, I think that West Virginia can bring those with mental illnesses to a level playing field, treating it as a health crisis and not criminalizing people for having issues like that. I think that would be important and helpful.
I think really localized community advocacy and community centers would be a great tool with assistance maybe from the state or even the federal government to help with training. So then people with handicaps might be able to get more support really on a local level.